Good afternoon, everyone. Before starting today's webinar, I would like to introduce myself. I am Dr. Khushboo Shah, working as a clinical therapist at BITS Institute of Physiotherapy from past 8 months. I'm coordinator for today's webinar. Today's webinar is on industrial and office ergonomics. The speaker for today's webinar is Dr. Dharmesh Contractor, sir. He is a professional physiotherapist and ergonomist. He has 14 years of clinical experience. As an ergonomist, he had been trained under the director of Daniel Columbia from Milan, Italy, who is a revised founder of NIOSH lifting equation in 2010. He is a registered life member of Indian Society of Ergonomics, that is MISE. He had worked with many multinational companies throughout India as an ergonomist. He has profound knowledge of ergonomics which can be helpful to patient in day-to-day life. He is associated with the company Human Scale, which deals with the products used in workstation setup. He is the owner of OPSIS Care, a rehabilitation center located in Vadodara, Gujarat from past 8 years. Presently, he is working as a clinical therapist at BITS Institute of Physiotherapy. This webinar is going to give you an insight on the various topics, that is, what is ergonomics, why do we need ergonomics, what are the benefits and risk factors of ergonomics, recognizing ergonomics problem and its solution, and of office ergonomics. After the end of this session, we are going to have a question answer round. So I request everyone, if you have any doubt, you can write the questions at the end of this session. And after the question answer round, we are going to have a live quiz session. So I request everyone to please stay online till the quiz session. I request all the participants to please turn off their microphone and video to let the webinar go smoothly. Now, I welcome today's speaker, Dr. Dharmesh Contractor, sir. Over to you, sir.
Thank you, ma'am, for such a nice introduction. Yeah, so today's webinar is on ergonomics that I will conclude like industrial as well as office ergonomics. So, am I audible to all of you?
Yes, sir.
Okay, my slides is visible. Can you able see my slides? Okay, whether my slides are visible? Okay. Yes, so good afternoon to everyone. So today's webinar is on ergonomics. That I will include like industrial ergonomics as well as office ergonomics. Okay, so ergonomics is a great term consisting of two different words like ergonomics. Ergonomics, the law of work, and nomics means the laws. Like before starting the session, I would like to tell that ergonomics it deals the three aspects: the worker, what work he or she is doing, and the work environment. Okay, so it concludes the three aspects: worker, work, and the environment. Okay. Now, what is ergonomics? So, like ergonomics is not an exact science that can be open to interpretation. Okay, however, with a little common sense goes along with. in the sense if we apply a little thinking of what is ergonomics and how we can apply ergonomics in various aspects, a little common sense is helpful to understanding to interpret the idea. Like and some certain consideration we need to consider, like we need to see the what under the ergonomics guidelines, what all basic criteria are in matching to the worker or the person. Okay? So it is not always a common sense, but we need to apply a logical thinking as well. Okay, so ergonomic is a study of relation between people and their work environment. As I said, it deals with the three aspects like work, worker, and the environment. Ergonomics is used to prevent the injuries caused due to the hazardous condition like lifting or bending or some jerky movements happening in the body. So how to control it, I will explain in my coming slides. It is a science of fitting the work to the user instead of forcing the user to fit the work. Okay? And it is used to increase employee safety and comfort and to optimize work performance and quality. So next question arises like, why do we need ergonomics? Okay. So people are having the issues of the back pain or the neck pain. Okay, as a physiotherapist and as an ergonomist, I have dealt with the patient like people are suffering from neck pain or the back pain. So instead of directly targeting on their symptomatic area, we need to assess as an ergonomist, we need to assess the what is the cause of the injury. So whether the injuries are happening for of prolonged stretching, whether what task he or she was doing, and under what environment. So as an ergonomist, we need to consider the three aspects. Okay, the what work he or she is doing under what environment and who is the person. Because the male and the female, if we go anthropometry ratio, the male and female are having different ratios and different percentage of lifting or doing any task. Okay, so examples of work and requirement that can cause discomfort, fatigue, injury, and illness are stretching to reach. Okay, if we are having a prolonged stretching, like if you want to do any overhead activity, and we have to make that in a stable position, then that's called as a stretching to reach position. Repeated heavy lifting, like if you are having a worker working in an industrial area who has to lift the goods or the object from the ground repeatedly, so that was an injury. Then high pinch force. Normally, the pinch force, the pinch force is crossing more than 3 kilogram, so there is a chance of getting injured with the hands. Working with the hands above the shoulder level, as I told you, like if you are having an overhead activity of the shoulder, so that will definitely lead to pain and aches on the shoulder. The handling object that are sharp, very hot, or very cold. Like there are some, you might be aware in a physiotherapy, there are particular kind of drafts or the pincher or the holding methods available, like pinch, hold, then hook hold, then grasping, then touch, and other various forms of holding the object. So for handling objects that are sharp, very hot or very cold, are very difficult or very injury to the worker or the patients. A longer period of working without a change in the body posture. Like we have observed in our profession, in physiotherapy profession, if we are giving a prolonged stretching in a particular position, and that also in an awkward posture. So we need to correct our posture in order to avoid the strain and stress on our body. That's listed static posture. So that will affect both on the worker and the therapist and the employer under whom he or she is working. Like if you consider an employer or a worker or a therapist, okay, so chances of getting fatigue, pain, illness that may affect his back, neck, and other body parts. Then low morale, okay, frustration and irritation, and these all factors will lead to it will affect the employer. for the institution or under what organization he or she is working. Like poor quality of the work can be seen on therapist. Then absenteeism, frequent he will take frequent leaves or frequent absenteeism can be seen on the therapist. Then higher cost of medical cost, like we will claim to the employer that under working hours or he or she is got affected. So to prevent that, company or the institution or the organization will hire the organizers. Okay, some effect on the company like higher employee turnover and training. Okay, so the company will has to bear the training to the therapist or the worker for his training part. What are the benefits of ergonomics? Like it will increase the return of investment of the company, as well as this is the I'll be focusing on an industrial area. Okay, I'll be coming to the office area in my latest slides. So right now I'm focusing on the industrial area. What are benefits of the uh, ergonomics? Like if people feel more at easy and comfortable on the job, they will be safer and there is a higher chance of quality productivity. Okay, so if the people or the worker health is fine, so the return of investment of the companies will go to higher rate and definitely will lead to higher morale to the of the therapist. So this will lead to that low medical or insurance costs. It reduces loss of time. Low absenteeism can be seen on the therapist or the worker. Less employee turnover. Okay, so the company or the institution does not have to recruit again and again of the new employee because the his previous employees are very fit and fine. So these are some benefits of getting an ergonomics. So what are the risk factors? Like risk factors are like physical activity, fatigue, then physical exertion, fatigue and recovery, then over-exertion, then cumulative trauma and body fat. What are risk factors? Like frequent hand use, like arm extended or bending our body, okay, vibration, then temperature, noise, fatigue. So these all factors conclude like there are some standard scales and standard rules applied on these different factors. Like if you consider temperature, the temperature it should be normal if you are working in an office, and temperature should be if you are working in a coal mine company or an industrial area. So there the temperature is different, and if you are working in an office, so there the temperature is different. So we need to consider all these factors as well. Now, understanding ergonomic risk. So, improper posture when completing office on industrial tasks can lead to musculoskeletal disorder. So, that may happen to damage and pain and sprain primarily in the lower back, shoulder, upper limb, and wrist and finger. Okay, they can cause disability and extended pain. Okay, so these all musculoskeletal disorder are present in the patient who are not following the ergonomic posture or will may lead to the injury to these all areas of the body. So one example I will give you, like a person or patient coming to you and complaining of pain and aches on the lower back area. Okay. So what we do, like we will be doing some SLR test and some other lower back facialization test to rule out the lower back area. Okay, so instead of that, if we just have a look on ergonomics factor, like we need to ask the patient in a different manner, like what he or she is profession. Okay, if the person says that he is an IT employee or he's a office worker who has a sitting job, sitting on a chair and for 8 to 9 hours a day and doing his job, his or her job. Okay, so we need to see the what profession he is under and how many hours he or she is working sitting on a chair. And because of that, sitting on a chair ideally that will affect his lower back. So Ideally, in an office ergonomics, the lower back, shoulder, and upper limbs are the three crucial area where people are complaining of pain and then lesser area like lower limb and the wrist and finger. These are some lesser area where the patient usually don't complain of pain and aches. Understanding ergonomic risk like first of all, if activities exceed our personal limit of stamina or strength, okay, two kinds of fatigue may occur, like whole body and a local mind. Whole body, like body fatigue occurs when several body parts are overexerted. As we as we take a physiotherapy as an example, like whole body fatigue, like if we are doing any activity which are exceeding our whole body, then the body will get exhausted and doesn't have a recovery time. Okay, so whole body fatigue happens when we are having our body in an extended position and localized like affects the particular part of the body that are working. Okay? That will affect the arms or hands or the uh, upper limb or the lower limb. Okay? Localized in the sense like it will affect only one part of the body instead of whole part of the body. So physical exertions like either whether the work is dynamic or static. Okay, dynamic exertion is where there is a physical movement of the body. Okay, like a dynamic exertion, like an example I will give you, like someone who is lifting a bucket full of water. Okay, he is supposed to carry from one area to another area. Okay, so lifting on one hand, single hand, instead of lifting on single hand and just continuing his destination point. Okay, we need to shift the bucket area from one right hand to the left hand. Okay, so that happens to dynamic exertion. Start holding from the starting area to the destination area. So to correct that, person has to shift the bucket from the right as well as on the left side simultaneously in order to perform the uh, muscular character zadels. Okay, next is the static exertion, is where the body part or the body is held in a place. Okay, that is an example like if we are doing a suppose let's take a physiotherapy. Let's take a physiotherapist. Okay, so he or she is doing stretching of the body part of the patient. So the body is usually in a static position. So that will affect our body part as well, not the patient, but our body part also get affected if we are maintaining our position in a wrong way. Okay, so it is often more tiring because the muscles do not have the chance to recover. As I said it before, like if we are doing any activity, like if you are doing any exercise or if you are doing stretching on the patient, okay, there should be a recovery time, and the exercise is to recovery time. There should be always 2:1 ratio. Okay, so 2 minutes for the exercise time and 1 minute for the recovery time. So nice example I will give you. Like in our school days, teacher used to give us punishment, keeping our hands forward, like right. So and why the teacher used to give that punishment? Because the teacher was going like some or other time we are and bound to lift our hands down because our hands are not in a position. It will definitely get tired, and we are bound to rest our hands in downward in a zero neutral position. So that was the best example of static exertion, like fatigue and recovery. The schedule like whether it is a localized fatigue or a whole body fatigue, we need to rest individually or body parts. Okay, if it is localized fatigue, we need to rest the body part in a local manner. Like if it is the fatigue on the hand or fatigue on the leg part, we need to rest it for 1 minute or how much amount of exercise we have given or how much we are giving to the patient. Okay, so comparing the ergonomics and a physiotherapist, we need to consider the physiotherapist role as well. Like if you are you are giving any trigger point release on the lower back area. Okay, so we need to consider first of all the patient has to lie down on the couch. Okay, so first of all we need to consider the height of the couch. The height of the couch should be according to the therapist's waist level. If the height of the couch is not according to therapist's waist level, so the therapist has to lean forward. Okay. So if the therapist is unable to stand in a proper position or unable to maintain his proper body weight, so he will definitely suffer from pain and aches rather than the patient. So localized fatigue and whole body fatigue in both the fatigueness, we need to consider that resting should be or the recovery time should be given to the therapist as well as to the patient. We should not directly forcing to the patient and continuing the exercise. There should be a proper 2:1 ratio from exercise versus recovery time. So in short, whether it is a localized fatigue or in general body fatigue, we need to have some body rest, not to the therapist as also the patient. Next comes the over-exertion. If you work in an activity that exceeds your stamina or strength, over-exertion and cumulative form of injury are possible. As I said you that whenever there is a over-exertion of the work, whether we are doing any teaching activity or any lifting or any bending activity, it should not be over-exerted. Okay? As an ergonomist, I will explain in my coming slide. Okay. So what happens where we are exceeding our our work. Second, cumulative trauma. Cumulative trauma, it will describe, consider the force, exertion, repetition, and posture. Okay, and as there is a no rest position, even to the therapist or even to the worker, there happens the cumulative trauma disorder. There are many cumulative trauma disorders like thoracic outlet syndrome and musculoskeletal WRMS, that's called as work-related musculoskeletal disorders. Like it happens to the uh, dentist as well. Okay. Over-exertion, the dentist has to maintain his static posture or doing a dental problem or a dental uh, in a dental clinic. If you go to the dental clinic, or dentist has to maintain his bend down and he has to lift his shoulder up and he has to operate the dental. So that's a example of static posture. So that happens in the cumulative trauma disorder where shoulder, hands, and wrist can happen. Sometimes that get affected due to the no rest given to the body posture. Analyzing tasks and recognizing problems. So as an ergonomist, we need to analyze the task first. Okay, like how many hours the patient is holding the object, what work he or she is doing, under what environment, okay, how long he or she has taken the breaks in between, okay, how often the total task was repeated throughout the day, how much force is involved for each body posture. So these are factors we need to consider before directly jumping and to the final goal or the route. So there are many scales I'll be discussing tomorrow. As tomorrow is again webinar on totally I will focus on the different scales and what scales under what work we need to use. These are some analyzing problems. Okay, the posture, considering the posture and the constant use of hands and fingers. Okay, so twisting and bending or the of the wrist. Okay, right on the median now passing to the carpal tunnel syndrome, which can lead to carpal tunnel. Okay, then repetitive hands and the wrist motion that may lead to tendinitis. Okay, that will the wear and tear of the tendon happens on the tendon area where the repetitive task is being performed. Suppose the example I'll give you, or suppose the worker is working in an industrial area, standing and doing any work, whether one machine is keeping the box, he has to leave the box and he has to keep it on a side. So if the worker is repeating that task, the injury may happen to the tendon area, and the worker will definitely suffer from the tendinitis or the tendinosis. Second comes the vibration. It affects the blood vessel in the finger, which can lead to Raynaud's phenomenon. Vibration in the sense of, uh, suppose if your worker is drilling any area, or if you are drilling our home on any walls or on the roadside, we need to have constant pressure on the machine area. So that constant pressure will definitely lead to Raynaud's phenomenon. Stars and the final thing is pinch grip. Okay, that can lead to contact stress on or over-exertion of the hand. Pinch grip if the grip is more than 3 kg, okay, and that will affect our hand, small hand muscle. So always see to that there is some particular guidelines that always the pinch grip should be less than 7 lbs or 3 kgs. Okay, it should not exceed 7 lbs or 3 kgs. If it is existing, then the patient or the worker will definitely lead to injury of the hand muscles. So as I told you, like there are different press or different holding methods like this grab grasp, like the total supported power grabs you can take, then hook grabs, then pinch grabs, and contact contact grabs. Okay, first of all, the posture, the constant use of hand and finger. Since we use our hand and finger for example, we have to be considered with the position of our hands, type of grip, force involved, vibration, pressure, temperature, and the number of repetitions. Suppose if the thing or the object in the in an industry is very sharp. If suppose if you are carrying any glass, we need to first of all need to consider whether the edge of the glass is in sharp or is blunt area. If it is blunt or sharp, we need to wear hand gloves and we need to consider accordingly we need to progressive work. A wrap or power grip is the best option. So have shown in the figure like what is the wrap or the power grip. Pinch force for over 3 kgs or 7 lbs can cause injury to the bone muscles of hand. Hook grip and contact grabs expose the operator to the potential of contact stress with a sharp or hard object. Okay, as I told you, if we are holding any object on like a glass, if we are holding in our hand, so that will definitely lead to an injury to the hand area. We need to have hand gloves. We need to wear hand gloves and to consider the we need to propagate the task. Do not strike object with your hand or any body part. So there are some tools available. So we need to use those tools and we need to do the task. Like we need to recognize the problem. As I told you, like suppose one example I will give you in this, like a patient complaining of neck pain. Okay, complaining of neck pain and going to a general physician, and general patient will ask the history why he or she has the pain. So the patient himself is not like patient will definitely tell that he has the pain on the neck area, but he is not aware how the pain is what evolved. Okay, so the doctor will stop his history taking part and will directly diagnose that the patient is having pain on the neck area. Okay, and he will give some multivitamins and anti multivitamins and painkillers he will give you, and he will send you home and he will call you back after 10 days or 5 days. Okay, but he is not diagnosing like what kind of work he or she was doing. Actually, he should ask like what kind of work he or she is doing. This will be aware with the patient as well. Like a patient has to know like if he or she is an IT employee or some industrial worker. So he must recognize how many hours he or she was doing, under what environment, and under what posture. So one fine day, a worker is working in an office, okay, sitting on the AC, okay, air conditioner, and continuing for 8 to 9 hours of work. Okay. So considering these factors, if he is working on the AC and not maintaining a good posture and working for 8 to 9 hours a day, so that will definitely that will definitely impact his neck and the body parts. Okay, so that body part, the patient who is getting affected with the same complaints, he will go to the doctor and he will describe that he's having a pain and ache on the neck area. So the patient himself is not aware how he got the neck pain, and he will go to the doctor. Doctor will prescribe the medicine, and same cycle, vicious cycle will repeat again and again. Patient will go to the doctor again and again. But we need to understand what kind of work he or she was doing under what environment. So the longer the reach, the greater effect of any weight involved. The more off center of the reach, the greater effect of any weight involved. This is the second part is a corrected posture or this corrected one. The first, the worker he was over-exerting the limb or the upper shoulder by doing a drilling machine. So second part, a tool has been implemented where they do not have to extend the shoulder and arms, but the simple by simply press keeping his upper limb in the level position, he can able to drill the wall. Now this one is second example, like we need to analyze the task first. Okay, before analyzing task, suppose in the figure as I showed you, like this, okay, we need to lift a load from the ground. Okay, so first of all, we need to what is the method of lifting any object from the ground level? Okay, like we need to go nearby to the object. First step. Second step is we need to have a hook grip. Okay, or grip of we need to have a hook grip as opposed to the ends of the weight. Okay, we need to have some measurement whether we can able to lift. We need to have an idea that we can able to lift with our hands or not, or whether we need an assistance for lifting the weight. Suppose let's take an example like if we can able to lift the weight of an object is hardly 2 kg, so we can able to lift the weight by 2 kg. So if the weight is more than 10 kg or it exceeds more than 25 kg and we cannot able to lift that object from the ground. So, and if you are then also a worker is able to lift the object, okay, and standing, keeping that object in a very far distance and lifting that object, that will affect our lower back muscles and that will injure our lower back. Okay, so we need to, the criteria is like we need to go nearby to the standing V-shaped position, keep our leg in a V-shaped position. The object should be in front of our body between both the legs. Okay, we need to instead of bending our back forward, instead of reaching that object forward, we need to bend our knee and we need to have some weight of evaluation first. Then we need to keep that keep the object nearby to the body. We need to stand up and we need to go to the destination and keep that object safely. So this is a perfect example of lifting any heavy object from the ground level. If that differs with what kind of shape of the object is. The shape of the if we are lifting any logwood from the ground. So lifting and logwood by single person is not possible. So definitely a two-person assistance is required. So two-person assistance, like one person is standing on the one side, another person standing on the other side. They have to lift the logwood and they need to complete the task in a safer manner. So here, the more off center the reach, the greater effect of the body involved. Okay, so our body should be in the centered area. Okay, it should not be very far area. Okay, whether it is a lightweight or higher, more weight of the object, we need to stand in the center area. So analyzing tasks like recognizing problem like, oh, okay, what if pushing or pulling is mandatory. So always you need to consider pushing area than a pulling area. So why pushing is better than pulling? Because it will make use of your larger muscles with less strain on your back. Okay, it will less likely to slip from your body. If the pull area is more, the muscle has to contract, okay, more, and that contraction, if we cannot able to pull that, if the weight of that object is more, we cannot able to pull that area or the object, then will definitely will lead to injury to our muscles of it. And so always we need to consider pushing area better than a pulling area. Suggest standing force limit are 15 lbs or use of both the hands. Okay, so while pushing that any object from one area to another area, first of all, ergonomic tool should be used. Okay, an ergonomic trolley or some weight lifting object are there available. Okay, we need to consider those objects and we need to carry progress our work. And the second part we need to clear, like there should not be any clutters of the objects fall on the ground. The area should be cleared. Uh, the pathway should be clear in order to consider the destination area. How we can reduce like the basics, like the design each workstation. You need to follow the checklist. Suppose if you are designing any workstation, okay, workstation, whether it should be whether it is the industrial area or office area. Okay, we need to design a workstation. We need to follow some under normal guidelines. We need to follow some checklist that these all things should be there in the particular workstation. Then only the workstation should be ergonomically corrected. Use ergonomically designed tools followed as a checklist. Okay, we need to consider an ergonomic designed tools as well. There are many ergonomic tools available in the market. Okay, so we need to consider what kind of work he or she was doing and what environment. Have work instruction for operate to follow. Do an analysis of the task. Okay. So before we jump into the directly, suppose suppose one person is having pain on the knee area. In an office, in an IT office, a person is having pain on the knee area. Okay. And suppose he is not aware about ergonomics at all. He is having 0% knowledge of ergonomics. He has not heard the term ergonomics as well. Okay. And he is a normal uh, worker working in an office. So he will go to his supervisor or the manager complaining that he is having a pain on the knee area. So you need to change his chair. The chair is improper. And the supervisor will have the discussion with the management part, and the management will take an action like what for what purpose he won't need a replacement of the chair. Then the ergonomics role will come into this picture. Like what ergonomics will do? Ergonomics will judge, like we will judge the posture first. We will evaluate the posture of the person, like whether what position he or she is maintaining sitting on a chair, what is the height of the chair he or she is maintaining, okay, and under what aspects of what ratio the person is unmovable is globally, how many breaks he or she is taking per day. Okay, so instead of jumping directly to task analysis, like instead of jumping directly changing the chair of the person, we need to evaluate first the scenario, and then only we can able to change the chair. Okay, so that's ergonomic role. How we can check the pain on the body part, whether the particular person is having definitely pain on the injured area body part, or whether he needs some gadgets, external gadgets that will improve his body part or to prevent his body part. Then using this factor, there should be constant use of hands and fingers. rotate if the use of constant hand and fingers are there. We need to rotate the jobs where hand user is lower. If the person's job is involving the rotation of the um, like minor activity, if the working posture, standing position, if he's doing minor activity of moving with the hands, whether he has to screw or unscrew the minor activity, he will shift his job or the task separately with the other multitask. So whether the arms are extended and unsupported, in that alter the design of the work session to bring the work closer. These are some factors we need to consider how we can reduce the risk factor. If the arms are extended or unsupported, we need to alter the design of the work session to bring the work closer. As I told you, as I told you in the initial starting of this webinar, like it's not a very rocket science. It's very logical thing we need to think and we need to imply on the body part of therapy patient. So altering the design of the work session that brings the work closer. Whatever work we are doing, if we are bringing our hands into closer activity to the body, and if we are operating that work, that will minimize the work on the shoulder and avoid the injury to the elbow and as well as on the shoulder. So one example I will give you. One example on the biceps. Okay, so all you can try is just stretch out your hand. Keep your other hand on the biceps of the shoulder press and just try to press it. How you feel, or whether you feel the form or whether you feel soft. Okay, feel form, right? Now slowly bring back nearby to the body and now you press. How you feel, whether you felt any difference or not. So that's what happens. If you felt difference, so there is no muscle tension happening in the shoulder area. But if you are keeping in a stretch position, okay, and if you are keeping in an extended position, that muscle will lead to an injury and will lead to pain and aches over the shoulder area and the musculature area. Yes, so we need to consider the factors as well. Like we need to consider the hand position. The patient is coming with you and complaining pain on the shoulder area. We need to ask first, like what he or she's profession is, and how many hours he or she was working. What okay, so this was an example of extended hands. Second comes the bending and twisting. How we can correct, like reposition the object in front of the worker and at appropriate height. Okay, if the bending and twisting are more frequently, the worker has to bend and has to twist his body in a frequent manner. We need to advise the worker to not bend to the ground level. Instead of that, we need to get some object, keep that weight on the object, or keep that object on some particular stand or particular tool where the bending should be avoided and twisting should be avoided. Use significant force. How we can reduce the force area, like reduce the weight of the load if possible. Keep your body in a neutral posture. Use a steadily. Reduce pinch forces. Use power grips and minimize lift risk. So these are some considerations we took. How some consider to use the risk factor of static force. Static body posture, like how you can correct the static body posture, like alternate between standing and sitting. Press one foot on the supported by standing. Okay, so one example I will give you, like if a female or if a housewife, the homekeeper was working in kitchen. Okay, so that patient complains like he is having a pain on the lower back area or the calf area or on the ankle area or the legs are sore while standing for prolonged hours. So we have to ask the patient, like if the patient is shifting his weight from left side to right side And on keeping, or else if it is not possible, you can able to use a tool of 2 to 3 inch or stool can be used. Keep your leg, one leg on the stool and another leg should be on the ground level. Okay. We have to shift our weight simultaneously from right to left side and left to right side in order to unbalance our body. Second comes the vibration. How you can reduce the vibration here? Like isolate your body from vibration flow, put it to a non-vibrating job and use better design tools. If suppose vibratory tools are available, how we can go nowadays better ergonomically tool design can be available in the market. Okay, how we can use a proper vibratory tool. We need to shift that. We need to shift our job, or we need to use some other tools where we can consider our. The second thing is the contact stress. Okay, how we can reduce the contact stress. Like cushion exposed to body parts, if wide hand or sharp object, and round or smooth rough edges. Like where whatever kind of object we are holding, we need to have wear some handy clothes and to consider the task. And second comes factors like under heat and cold, like limit exposure to temperature extremes, use heating or cooling systems, and wear protective clothing. And last one is for noise reduction, reduce exposure to high noise floor, wear hearing protection as well as and when it is required. These are some reducing factors how you can reduce our risk factors. While the person is having a lifting problem, think about the destination, make a clear path before moving on. Okay. So wherever we have to keep our load properly, we need to have some destination clear. The pathway must be clear. Balance yourself with your feet positions, shoulder width apart. Position one foot slightly ahead of the other. As I told you, like we need to have some V shape of foot. Our leg should be in a V shape, and we need to lift our body, lift the object from the ground, kind of like putting that object in the front of our body in a central position and to lift that object. Remember, often do more lifting in their work areas and daily life. People don't recognize how many kind of lifts they are doing in their working time. As I told you, you need to keep the weight of the object should be kept in center of the body. Okay, we should not bend our back. Instead of that, we need to bend our knee to lift any object from the ground surface. Okay, do not jerk or twist while lifting any object. Okay, turn your feet to avoid back injuries. Like there is a 90-90 degree turn with the load of your object. You need to have some 90-90 degree turn and you to twist our body. It's not hold the object, it's not twist your body abruptly. We need to have some step in 90 degree, then we need to shift our body weight to 90 degree and again 90 degree, and you need to rotate our body. Ask for help or get mechanical assistance if the load is too heavy or as I told you, like or the load is too large, you need to ask for the assistance of the other person, or there are some ergonomic tools which where you can use that to lift the object. Awkward position, like poor posture, place unusual or excessive force on body parts. This can even include sitting or standing in the same position for a long time. Awkward positions create unnecessary stress at the wrist, shoulder, neck, causing you to get tired faster. Repetition. Fatigue and strength build up when tasks involving motions are performed repeatedly for hours without break. Okay? So wherever whichever activity we are doing as a physiotherapist, wherever whichever activity we are doing, okay, we need to consider breaks in between. Like if you don't keep a breaks, like suppose if you are doing any exercise, you are giving an exercise to the patient, and if you don't consider taking the breaks in between, suppose patient is having pain on the knee joint, and you are doing an passive SLR. Okay. So you are just giving it passive. You are just lifting it manually, and manually you are doing 10 repetitions or 20 repetitions. So the patient is not lifting his or her leg by his or her pressure, but he is just limping her weight or his weight on your hand. So you cannot able to lift the patient's leg for more than 20 or 30 repetitions, right? So we need to consider recovery time, like we need to consider like 10 lifts. If you are getting tired in 15 repetition of SLR, do a seven lifts, then again, seven lifts batch wise, not continuously lift, not do the SLR movement continuous. So that should be the repetition, should be in a normal position. It should not injury your body in order to treat the patient. We need to first consider the posture and the factors of ergonomics on the therapist. Then only can consider the patient's improvement. Otherwise, you will be in the position of pain and weakness. You need to take a treatment. You change tasks during the day or take periodic breaks. As I told you, there is two kinds of breaks available in an office. Okay, in an active office, there are two kinds of breaks, like macro and micro. Micro and a micro break. Macro in the sense a larger break, and micro in the sense a small, shorter breaks. Okay, macro breaks that is the lunch break, where whenever the work is taking a lunch break, and micro break in the sense like between 1 to 2 minutes of break, where the worker or the professional has to do some checking exercise during his breaks. And examples are like reaching, twisting, bending, and excessive stacking. So these are some examples given where the worker is having the pain or ache by repeating the action, okay, and without taking a breaks in between. So we need to consider breaks in between. So those breaks will give you the recovery time. So recovery time is a must. We need to keep a must in the patient's treatment for protocol. So that's all for the industrial working or industrial, how we can consider the industrial uh, factors. Now I will just elaborate the office. So whenever we are just thinking of ergonomics, in our mind there comes a chair and a table. So first of all, we need to uh, just remove that wrong preconception that thinking in ergonomic, we should not think of office chair and office table. We need to ergonomics in the sense we need to consider the aspect, worker, work, and the environment I told you. So right now I will be discussing the office ergonomics. So how the office ergonomics comes into posture. So under certain guidelines, like the OSHA guidelines, that's the occupation safety and health and administration guidelines. There are some particular norms where we have to consider, which we need to consider to change the office setup or to develop an office setup. Yes, suppose a particular person is sitting in the first picture, as you can see, person sitting in a perfect ergonomical way. So if we just type on a Google, like show me like what is the ergonomic posture, Google will show you the n number of authors or different kind of ergonomic posture he will show you. Okay, but you are not aware what is the standardized one. How we can able to standardize the way. So sit up with your back against backrest and your feet flat on the floor. Otherwise, if you cannot rest your feet on the floor, use a stool or some smaller stool to avoid your leg cramps camping on the legs on the calf muscle. You should be able to view your screen without tilting or turning your. Okay, so we are going into an IT office, and if the person is of manager post, a manager post will definitely have it is a laptop or some bigger screen on the side of the table, and the keyboard will be there on the front of the table, and he will be typing like this and will be looking like this. Okay, so vision is there on the right side, and he's typing on the straight way. Okay, so that's that chance of neck pain on the next time, rotating his neck on the right hand side. So that should not be happen. When wherever we need to use the screen, keep the screen in front of you. Whether we are using a laptop or a desktop, keep that screen in front of you. Keep your keyboard in front of you. Maintain the ergonomic posture in a straight way, and just maintain it and work it properly. In the sense, like we should not be a robotic posture or a robotic lifestyle. That's why I have included like we need to take a micro as well as micro breaks. So if you are maintaining the posture, taking breaks in between, and drinking a lot of water in between, doing frequent stretches, if you are just considering all these factors, definitely the person will not have pain or ache now or not. So according to my protocol, instead of prevention, better than cure, is the same. But according to me, treatment is better than cure. Is my so better to cure it. Okay. So treatment. So we need to consider all these factors. And place document. Yeah, like there are three zones available to placing your documents on your workstation. Okay, like first degree, second degree, and third degree. Primary, secondary, and tertiary zone. Like primary zones, the documents which we use frequently, like keyboard, mouse. Okay. So first of all, maintain proper posture. We are working on workstation. Keep the mouse or keyboard medium by the body. That's called a primary zone. Secondary zone would involve the screen or document folder. Okay, where there should be a one hand distance should be there to keep in a secondary. Tertiary zone where it which all things which you are using very rarely. Okay, that all things from the tertiary zone. So three zones so we have to keep in mind primary, secondary, and tertiary. You should not have some overreach activity to avoid the expression of the things. Next one is comfort and fatigue management. Reduce comfort and fatigue by moving your hands and by changing position. Take short breaks and do frequent stretching. So these all things can be implemented in an industrial area. So this I would consider on an IT office people or an office worker. The person who are having the more on the computer usage or sitting activity need to take short breaks. You need to change position if you are sitting in an ergonomical posture. So what ergonomical posture says, like there should be 90 degree rule. Okay, 90 degree first 90 degree should become like 90 degree visual height, 90 degree upper arm and lower arm height, and 90 degree upper leg and lower leg. That's a normal ergonomical way to sit on a chair. Okay. So we need to keep this ergonomical posture in our mind, and we need to follow the steps. Self-help and when sitting or standing, face the work directly, use a good posture, okay, avoid constant raising or bending, place frequent use material within closed reach area like the secondary area, avoid rattling on that telephone when with your feet. Okay, the person who are having more of the phone area or like a receptionist, okay, you can ask them to wear a headphone instead of holding or instead of handling the phone on the one hand and instead of bending like this. So you can advise the patient how many gadgets are good gadgets are available where you can use the headset or some to just click on or Bluetooth and to connect. Definitely without bending on a expenditure part, the person can able to answer. false. Refocus on distant objects when feeling tired. So we to reshuffle the object which you are constantly using. Person is constantly using is uh, uh, document folder or something which are kept in tertiary area. Okay, that tertiary area should be taken back to the secondary. So reshuffling should be done whenever required by doing it. Now comfort and fatigue management will is like standing or the industrial work. So if the standing or the industrial work is more where we require standing area, so we need to implement a rubber mat which prevents less comfort, which will prevent injuries on our legs and will prevent our legs in a comfort manner. Okay. And wear gloves. Why we need to wear gloves? Okay. So wearing gloves will affect our hand to get injured by a sharp object. So that's why I have mentioned wearing gloves. Install extra insoles and lift in the shoe. Okay, there should be enough cushioning area inside this whole area. Okay, though if the sponge mattress is not available with you, we can install extra insoles and lift your. Avoid kneeling. If kneeling is necessary, wear knee pads. If the area where kneeling is necessary, or there is no chance of shifting your job from kneeling activity, you need to implement a knee pad. You need to wear knee pads and to do that. If at all it's not possible. If the task is of sitting area, we need to first of all consider the chair. As I told you, the chair should be like there are different many chairs are available in the market, like ergonomical chairs. In ergonomical chairs, also there are many variations, many designs available in the market. Or what chair is good for your office depends upon your budgets. There are 20,000 also chair available, 25,000 chairs available, and 1 lakh chair also. But that depends upon your budgets. Okay, so how much is your budget? That depends on your money. So that's a proper. There are criteria of getting an ergonomic chair. So no lost cause. What you can do. So like I thought it. So we need to add some discord factors. We need to add in our lifestyle to consider this economical way how we can correct it. Not only professionals, but also in the if we are just considering all these factors and implementing in our daily lifestyle, we will be free from this pain and being in shape by exercising regularly, eating healthy diet, and maintaining a vigorous lifestyle affects how you feel at work. That will just keep it away from all this pain and anxiety. You are just having your healthy lifestyle, healthy diet, and healthy exercise. So what you can do to change what is affecting you negatively at work. You need to just whatever affects in your work lifestyle, you need to report it to your supervisor or manager that this all changes should be done. This call I'm getting affected. So as and when you are getting affected, the manager will take an action accordingly. Report malfunctioning equipment. Like if your chair is not functioning properly or the chair is broken, you need to just have a request to your manager or supervisor to replace your chair. Apply the simple techniques to everyday routines and in and out of the work. It's not always on the art area. You need to apply in the routine lifestyle as well. Now, same thing. So tomorrow there will be my second webinar. So my second webinar, I will be discussing the skills, software, or checklist, the OSHA guidelines, and what all activity we can do under what software or the checklist we can diagnose the particular risk factors. I will be discussing it. So, any questions? That's all for today's seminar. So, any questions or doubt you can ask me. You can type in the comment box and you can ask questions.
Thank you, sir, for such a nice webinar. If you have any doubts, Participants, if you have any doubts, you can write the questions in a chat box. Participants, if you have any questions, you can write down your questions in a chat box. So we are waiting for 1 more minute. Participants, if you have any questions, you can write down your questions in a chat box. Sir, I think no questions and no doubts. We can move on to the quiz session. So I request Dr. Dharmesh Contractor, sir, to please share the link for the online quiz. I request all the participants to please stay online. Sir is sending the online quiz link here.
So I just shared the link. Just click on the link and you can just start filling your email ID first. Then you can start answering the question. There are 10 questions and the maximum time is 15 minutes. So after 15 minutes, like now it's a 4-7. So after 15 minutes, I will close the answering.
I request all the participants to click the link that is being shared in a chat box. The duration is 15 minutes for the quiz session. If the answers are incorrect, you can contact Dr. Dharmesh Contractor, sir, after the session through mail or through text messages.
Yes, so I have mentioned my email ID. Those people, those candidates who cannot able to answer the questions then, or having any doubt, they can definitely contact me via mail or my mobile number is given. Yes, you can definitely contact me later if you are not understanding it or if the answer is incorrect. So at 4:15, I'll stop the answering machine. By that time, you can also.
Dr. Dharmesh Shah,
Yes, sir. Yes,
there
ma'am.
is some there is some there is some technical error. Paras sir is not able to fill the form. Is there any other link you can share here, sir?
Hold a
Sir
second.
is not able to fill the quiz.
I will send one more time.
Again, Shabnam Kapade cannot submit the form. She has written here.
I think you need to enter your email ID first. Then only it is possible to submit the form.
I request all the participants to please log in first and then submit the quiz.
Yes, first of all, you need to log in with your email ID, whether it is a Bahrain Institute of Physiotherapy email ID or whether it's a personal email ID, doesn't matter. You need to log in via email ID. Then only you can able to submit the form.
Okay. Okay, sir. Yash Avasthi has submitted the form. Okay. Thank you.
Thank you.
Welcome, ma'am.
Yeah, it's already been shared on the screen. You can have a look on your screen. I will share my email ID.
Thank you, participants, for submitting the form online.
Okay, so I'm just closing the response.
Okay, sir.
And a video I'll be playing. You can have a look on the video. That's a ergonomical video. Just to brush up the whatever I told you, just to brush up the summary part. Have a look on the video. Yes, can you able to see the? Can you able to see? Can you able to visualize the playing video? Yes, so that's all for today's webinar. So those people who are having any doubt or any difficulty of getting your answers incorrect can definitely contact me via email ID. I already mentioned my email ID. And contact me via email ID or contact me by mobile number.
Thank you, sir, for such a nice presentation. I'm sure everyone thoroughly enjoyed the webinar. Now, I would like to thank and show our gratitude to Founder, Chairman and President Shri Jagdish Patel Sir and Managing Director Honorable Shri Dhruv Patel Sir and Joint Managing Trustee Srimati Kamal Patel Ma'am. I would like to thank our campus director Srimati Hardi Patel Ma'am, our principal Dr. Mehul Jadhav Sir and our vice principal Dr. Sarfraz Nawaz Shah Sir, BITS Institute of Physiotherapy for their immense help and support. I would also like to thank Avni Ma'am, Head of Department, Computer Department, Babaria Institute of Technology for technical support. I would like to thank Gadedada for graphic designs and lastly to all the faculty members, participants and students for joining this webinar. Thank you everyone once again. Thank you a lot.